Hi, Dr. Gniady. I came in today because my father has pretty severe hoarseness, and I'm concerned, and I just didn't even know where to start. Could you tell me a little bit about why people get hoarse, what the diagnosis is, some different treatment options? I'm sure there's a lot of different reasons for it. Can you give me an overview?
Sure, yeah. So hoarseness is certainly a very broad complaint, and people use that term to describe different types of problems with the voice. People in general describe voice problems differently. You'll hear hoarseness or dysphonia, or I've got a frog in my throat, or scratchy voice, but you know, we lump those all under the category of voice problems and hoarseness. And really the starting point to me is first and foremost getting a listen to the voice, and that gives us a pretty good indicator right away of what may be going on. But kind of generally we divide things into sort of structural problems, which can be anything from lumps and bumps on the vocal cords, which could be, you know, a nodule or a polyp, to things more concerning like a cancer, and sometimes as simple as inflammation from people overusing the voice. But those all cause kind of vibration problems for the vocal cords. The other kind of big group tend to be what we call either functional or neuromuscular problems, and those have to do with kind of how we use the voice box and how we move the muscles of the vocal cords and use the rest of the muscles in the throat to produce sound. And we can see problems there from paralyzed vocal cords after people have surgeries. We could see problems with other types of neurologic or neuromuscular disorders like Parkinson's disease, or one very specific to the vocal cords called spasmodic dysphonia. So we try to use just even those first few seconds of hearing the patient speak to at least give us a broad idea of what type of voice problem they're having. And then from there we'll try to dig deeper to find out exactly what's going on and what we can do to fix it.
What kinds of testing do you do to try and come up with a diagnosis after you've heard the voice and you kind of pick a direction? What's involved with testing?
Sure. So we always want to get a good general physical exam, you know, looking at the patient's whole head and neck system, because it's not all the vocal cords. There are many other things that contribute to our voice aside from the vocal cords. But at the end of the day, we want to get a good look down at those vocal cords as well. And we usually do that with a technique called video stroboscopy. And that involves us basically using either a flexible camera in the nose or a rigid camera through the mouth to look at the vocal cords, high definition video, really good magnification so we can see little structural problems. But then we combine that with a very specific type of strobe light that allows us to actually see the vibration pattern of the vocal cords. And that's the really important part, is that if we can't see how they're vibrating, we really don't know much about how they're working. And that's all the tests that we do here in the office. And by the end of it, we usually have a pretty good sense of where the problem is coming from.
What types of treatment options are then available?
So the treatment is going to depend on the diagnosis. So if somebody has a lump or a bump on the vocal cords, sometimes they need us to take those off of there, little nodules or polyps. Sometimes they may just need some therapy though. We can get kind of wear and tear type lesions on the vocal cords that may actually go away if we fix someone's abusive vocal pattern. We see this a lot in people who use their voices a lot at work. They can get little callus type lesions on the vocal cords. If there's a cancer, obviously we want to get that off of there. But if it's a neurologic problem, that can be a little bit tougher. We do have a number of very good treatments there, but again, depends on, you know, we treat a vocal cord paralysis very differently than we would a patient with spasmodic dysphonia.
Do you work with speech pathology at all?
We work extensively with our speech pathology colleagues, and as I said, that many, if not most of the time, the answer is some voice therapy. Even if there is a structural lesion on the vocal cords, many times people don't need me to take it off of there. We can oftentimes fix their vocal pattern and allow the vocal cord to heal. Tension issues are also very, very common. People just kind of misusing the voice, and those we do a really good job on with speech therapy.
So I guess the next step would be to bring my dad in, have you take a listen and do some of this testing and then determine what the treatment path would be. Usually how long does all of that take?
The initial visit is typically about half an hour. We will get the story from him first and foremost, and that allows us to both spend some time listening to his voice and get all the details of how long it's been going on and what seems to be making it better or worse. We'll take a look at his medications to see if any of that may be contributing. And then we'll get a good look down at the same time. And usually we can do all of that in the setting of kind of a standard office visit. At least enough to tell us which direction we need to go with things.
Okay, great. Thank you so much. This has been so helpful, and I will get with your scheduling department and get an appointment set up.
Great. We'll be happy to take a look.